What is type 2 diabetes? In this video, we're going to discuss what is type 2 diabetes. But before we get into that, it's important to point out that this is actually part of a longer video which covers both what is type 2 diabetes as well as how you reverse it. For ease of use, for those of you who are simply interested in just knowing what type 2 diabetes is and how it develops, we've made this slightly shorter video which is only using some of the slides. If you're also interested in how to reverse type 2 diabetes, you can either watch the full-length video, or after this video is over, you can do the portion that is on how you reverse type 2 diabetes. But in this video, we're going to discuss how type 2 diabetes develops and what we think is really going on. In order to do that, we first have to discuss how the body regulates our blood glucose levels. Moving on, we'll talk about what is type 2 diabetes, what do we see in people who have type 2 diabetes. Then we'll discuss how type 2 diabetes develops. This is called the twin cycle hypothesis. This is the predominant theory on how type 2 diabetes develops over time. Next, we'll discuss signs and symptoms of type 2 diabetes, as well as risk factors for type 2 diabetes. And then finally, we'll discuss the diagnosis of type 2 diabetes. How do we determine whether a person has type 2 diabetes or not? We kind of focus on 3 different tests, and we'll discuss those as well as the criteria one has to meet to be either pre-diabetic or type 2 diabetic. So let's dive into blood glucose control basics. What we're looking at primarily, the things that regulate blood glucose levels. We're talking about the liver, pancreas, muscle, intestine, adipose tissue or body fat, and the kidney. We don't really need to discuss the kidney too much. We're going to start, we'll put our intestines right around here. So when you consume carbohydrate, this increases your blood glucose levels. And what happens is this blood glucose circulates to the pancreas. The pancreas identifies this glucose and secretes insulin. What insulin does is it tells insulin sensitive tissues such as the muscle, liver, and fat to pull glucose from the blood, and this lowers your blood glucose levels. It stimulates glycogen formation in the liver, so that the liver is kind of a central regulator of blood glucose levels. It stores blood glucose levels, blood glycogen to kind of release glucose into the bloodstream. The storage form of glucose is glycogen. You store it in your liver and your muscles as well as other tissues as well, but those are the primary depots of stored glucose as glycogen. And what happens is when your blood glucose levels begin to drop, you get low blood sugar. This causes the pancreas to secrete another hormone called glucagon. Glucagon goes to the liver, tells the liver, hey, we are experiencing lower blood glucose levels. Release some of your stored glycogen. When it does this, glycogen is broken up, turned into glucose. The glucose enters the bloodstream and raises your blood glucose levels. This is the basic way that your body regulates your blood glucose levels. So just to kind of sum up, consume carbohydrate. Carbohydrate gets broken down into glucose. Glucose gets absorbed into the bloodstream, increases your blood glucose levels, causes insulin to be secreted by the pancreas. Insulin tells cells that are sensitive to insulin to pull glucose out of the bloodstream to bring that blood glucose down. Then, when we are in a period of fasting, our blood glucose levels begin to drop. When our blood glucose levels begin to drop, this tells the pancreas, hey, we need more glucose. Pancreas secretes glucagon, which goes to the liver. Liver pumps out glucose to raise blood glucose levels. Type 2 diabetes causes a situation to mess this entire system up, which we will discuss next. Now, what do we see in type 2 diabetes? We see what is a triumvirate of effectively energy excess. We see hyperinsulinemia, which is high insulin levels, hyperglycemia, which is high blood glucose levels, and hypertriglyceridemia, which is high triglyceride levels. We also tend to see some defects in lipid or fat metabolism. You'll generally see increases in LDL cholesterol, maybe decreases in HDL cholesterol. But primarily what most people think of with respect to type 2 diabetes is the high blood glucose levels. And the reasoning behind this isn't necessarily that hyperglycemia is the worst effect here. Hyperinsulinemia hyperlipidemia and hypertriglyceridemia are also very, very bad for you. The reason blood glucose levels are more commonly associated with type 2 diabetes is that they're very easy to measure. You can measure them at home, and it's kind of a very simple cause and effect. You can do certain things and lower your blood glucose levels. Things like insulin and triglycerides are simply not measured at home. It's harder to measure them. You have to send it out to a lab, and most efforts are put towards measuring blood glucose levels. But that does not mean that having regular blood glucose levels isn't necessarily good. Having regular blood glucose levels with high insulin and high triglycerides is bad as well. You can't just kind of, you don't really just want to kind of game the system by lowering your blood glucose levels. You want all three of these things to come down. Type 2 diabetes, the patient does make insulin. They're insulin independent. They don't need to take insulin, at least at the very beginning of the disease. But what happens is receptors on the cells of the insulin sensitive tissues decrease it. And this makes those cells insulin resistant. So going back to our model before, what happens is blood glucose levels increase. The pancreas notices that these blood glucose levels increase, so it secretes insulin, and this insulin circulates, but it does not cause the muscle, the fat, or the liver to take in more glucose, so blood glucose levels stay high. The pancreas notices this, increases insulin even more, and so you have high insulin levels above what is physiologically normal. What's interesting about this as well is that these cells that are secreting the insulin are called beta cells, but the cells that secrete glucagon by the pancreas are called alpha cells. And what happens is these also become insulin resistant. Insulin will generally shut down glucagon release, but what happens when these alpha cells become insulin resistant is that we are getting too much glucagon at the same time. So in addition to your cells not listening to insulin and glucose circulating more, we have high glucagon levels as well, which are telling the liver to dump glucose into the blood to raise blood glucose levels. So in addition to your cells not pulling glucose out, you have the pancreas telling the liver to make more glucose to dump into the blood because glucagon levels are high as well. Now, type 2 diabetes, there are some factors that kind of increase our risk for it. The older we get, generally speaking, we become more insulin resistant and our risk of type 2 diabetes goes up. There are genes related to type 2 diabetes. The problem is most people have these genes. They're often referred to as thrifty genes, and the belief is that we evolved to have these thrifty genes. Ethnicity, non-whites are generally, at least African Americans and Latinos, are generally at an increased risk. And lifestyle is one of the primary, if not the primary driver of the disease. And what we're looking at through this whole thing is excess energy availability compared to energy need as the key driver. In other words, you're consuming more energy than you need, and what's happening is you're taking this energy and shunning it into fat cells, and over time you meet a certain threshold which causes you to deposit fat in places where it's not supposed to be. This idea that chronic overfeeding, as well as other factors driving fat accumulation to the point of exceeding our ability to store excess energy as body fat and dumping it into the liver and pancreas, is known as the twin cycle hypothesis of type 2 diabetes, and these results have been reproduced over and over again. Evidence has shown that when you reduce fat in the liver and the pancreas, that you get restoration of normal blood glucose control. This has all been shown multiple times over and over again. So this is the predominant theory of how type 2 diabetes develops. And the way it works is that a chronic positive calorie balance, meaning you're not simply just eating too many calories in a single day, but chronically doing it over and over and over again, coupled with pre-existing muscle insulin resistance, causing us to take excess energy stored into our body fat. We then eventually meet what is a personal fat threshold. We can only put so much body fat on, and this is genetically predetermined, which explains why you can have lean people with type 2 diabetes as well as morbidly obese people with it as well. So you meet this personal fat threshold. The energy has to go somewhere, so we initially begin dumping it into the liver. Now, before we move on, it's important to point out that there are some acute things that we can do that can reverse pre-existing muscle insulin resistance. For example, sleep deprivation drives muscle insulin resistance. So if we can get better sleep, we can kind of work on that avenue, as well as being more physically active. We'll discuss that, but generally speaking, the more sedentary you are, the more insulin resistant your muscles will be. So you're just going to kind of dump excess energy into the body fat stores until you meet your genetically predetermined personal fat threshold. Then the excess energy is going to circulate and get deposited into the liver. When this happens, we get something that's very similar to what happens in body fat stores. With body fat stores, as they fill up more and more, they begin to be infiltrated by immune cells. These immune cells induce inflammation. You get all these inflammatory cytokines, and that can induce tissue insulin resistance. Same thing happens into the liver. The liver is now resistant to the effects of insulin. Insulin tells the liver to stop dumping glucose into the blood. On top of that, you get increased glucagon release, which is telling the liver to put out more blood glucose. As a result of this, the pancreas senses this high blood glucose levels and pumps out more insulin. And this kind of cycles through until we've, begun pumping in too much fat into the liver. This excess energy then makes its way into the pancreas. We begin depositing fat into the pancreas, and in the same way that this excess fat impairs liver regulation of blood glucose, it does the same thing to the pancreas. So initially what we're going to see are cells in the pancreas becoming more insulin resistant. That includes the alpha cells that secrete glucagon. So the pancreas, in addition to pumping out too much insulin, is pumping out too much glucagon. Now that the liver is insulin resistant, this kind of insulin resistance, the liver not listening to insulin, causes the liver to dump glucose into the blood. At the same time, glucagon is telling the liver to put glucose out into the blood. We elevate blood glucose levels further. And it's just really interesting that these alpha cells, at this point, the ones pumping out glucagon, are insulin resistant as well. Over time, this causes the pancreas to decrease its insulin response to ingested glucose. This causes a further rise in postprandial glucose. Postprandial glucose is just simply the post-meal, after you eat, blood glucose levels. So on top of your liver just pumping out too much glucose, you are going to have a decreased insulin response to meals, and this is just going to cause chronic hyperglycemia, hyperinsulinemia, till the point that your pancreas stops working, and then insulin levels are going to go down, and we're going to have increased hypertriglyceridemia. When we look at hyperglycemia and hypertriglyceridemia, when we have both of these at the same time, it is clearly due to chronic energy excess. If we only had hyperglycemia, we wouldn't see, this would effectively be that the problem is simply just too much glucose in the system, but it's too much energy in the system. Those excess triglycerides are getting dumped in the liver and into the pancreas, and they're interfering with the functions of both. There are a number of signs and symptoms of type 2 diabetes, and it's important to point out that you do not have to move to full-blown type 2 diabetes to experience these symptoms. You can experience them in prediabetes, because during prediabetes, you are going to experience hyperinsulinemia, hyperglycemia, and hypertriglyceridemia, and these are at least part of the things causing the symptomology of type 2 diabetes. So you will experience something such as polyuria, which is excessive urination, and polydipsia, which is excessive thirst. These two things are related. It's the water balance. When you pee too much, you lose too much water, so you are thirsty more. You also experience polyphagia, which just means that you overeat, and which is clearly why we are seeing things. We are seeing these accumulation of fat. There's excessive calorie intake, and so part of the problem with type 2 diabetes is it's a progressive condition. Some of the symptoms actually promote it, and one of those is that you just kind of chronically feel hunger. This may be related to leptin resistance, which leptin is a signal that tells you to stop eating, and what happens is when you have leptin resistance, you don't get that signal, you eat too much. That is polyphagia. Unexplained weight loss, this is generally going to come later on, after your body is just not capable incapable of storing body fat and it's not really listening to insulin. That's more of a unexplained weight loss is more of a condition or symptom that happens deeper into the type 2 diabetes diagnosis. Fatigue, irritability, blurred vision, frequent infections because the immune system is impaired, because you have all of these immune cells infiltrating fat and adipose tissue and causing inflammation. Acanthosis nigricans, which is the image here, it's kind of a browning of the skin, particularly in creases. And lactic acidosis and ketoacidosis, this is bad. Effectively, this means that the blood and tissues are becoming too acidic. In addition to the signs and symptoms that occur as type 2 diabetes is developing, there are consequences of poorly managed diabetes that happen over the long term. Things like vascular disease, effectively the small blood vessels supplying blood to your organs and tissues get blocked up with plaque. This decreases circulation, and you can experience amputation of your fingers or toes. You can also see impaired function of your organs. They're all supplied by small blood vessels. Blood vessels get progressively smaller as they get to the tissues. Additionally, you can this kind of vascular disease will also manifest itself in heart disease as well as erectile dysfunction. Those are small blood vessels feeding into the erectile tissue in the penis. Hypertension, this is created by vascular disease. Retinopathy, which means these small vessels that are supplying the eye are now not getting oxygen and blood to the eye. This is what we see over here, diabetic retinopathy. This is normal vision. This is what happens in diabetic retinopathy. Again, effectively caused by poor blood flow to the small vessels supplying the eye. Neuropathy, same deal, damage to the small blood vessels supplying the nerves. Nephropathy, this is kidney disease. This is damage to the kidney, the nephron specifically, and this is because it's not getting the blood supply that it needs. Alzheimer's disease, which is often referred to as type 3 diabetes. This is probably not simply due to vascular disease. Vascular disease is certainly playing a role, but there are other factors at play as well. And there are a number of gut motility disorders as well as general gut disorders that can occur. This is not only caused by the vascular disease. Vascular disease definitely drives it, but there are other factors related to this, things related to the microbiome, things related to the nerves, the enteric nerves. You can get an enteric neuropathy, which is damage to these nerves that regulate motility in the gut, but these nerves also regulate hormone secretion and other things going on with the gut as well. There are a number of risk factors for type 2 diabetes. As I mentioned, family history is important. This is simply not referring to genes. There is a heavy genetic component to this, but most people tend to have these genes. But also things you may kind of learn from your family, behaviors that you learn from your family. So family history is kind of a combined genes and environment issue. Being African American, Latino, Alaskan American, Pacific Islander, Asian American, Native American, effectively non-white, these people generally have a higher risk for type 2 diabetes. Being older than 45 years old, a lot of that can be driven by behavior, increased feeding, being more sedentary than you were when you were younger. Being overweight and obese, clearly in a disease of energy excess, being overweight or obese is going to increase your risk. Being sedentary, because being sedentary increases your risk for muscular insulin resistance, which can help kind of drive this twin cycle. Having other components of the metabolic syndrome, which are hypertension, the hyperlipidemia, problems with like your LDL, HDL, or triglycerides, having central adiposity, which means, effectively having a higher waist circumference, effectively the things that predispose us to all disease. These are risk factors for type 2 diabetes. These are associations. So clearly, is type 2 diabetes causing the increased waist circumference, or is the increased waist circumference causing the type 2 diabetes? Risk factors. These are saying that you are at a higher risk. So it's not necessarily that things like, say, high LDL cholesterol cause type 2 diabetes. They're more a component of the disease. History of cardiovascular disease or just stroke, same type of deal. Type 2 diabetes can cause cardiovascular disease. So it's not necessarily that your cardiovascular disease is driving type 2 diabetes. The idea is that if you have cardiovascular disease, you also have potentially type 2 diabetes. and PCOS, which is polycystic ovarian syndrome. Interestingly enough, it seems that polycystic ovarian syndrome may be caused by insulin resistance, increasing androgens in females. So if you have PCOS, there's the potential for a higher risk of type 2 diabetes. How do we diagnose type 2 diabetes? Well, we have three ways that we do this. I mentioned hemoglobin A1C, which is effectively a 3-month average blood glucose. If you have hemoglobin A1C of 5.7 to 6.4, you are said to have pre-diabetes. If you are over 6.4%, you are said to have overt type 2 diabetes. And it's kind of incorrect to say type 2 diabetes. This is also how we diagnose type 1 diabetes as well. So here we use DM, which is diabetes mellitus, but we're kind of focusing on type 2 diabetes here, so we're going to kind of stick to that. Your fasting blood glucose levels, which are not great, not a great marker. They are very very easy to affect. You can have high fasting blood glucose levels and you can have a low hemoglobin A1C. For example, my last fasting blood glucose level was 101. I got bad sleep the night before, but my hemoglobin A1C was 4.7. So fasting blood glucose is just not a great marker. This was the marker we previously used most because it's much more accessible. And people with pre-diabetes have a fasting blood glucose level of 100 to 125 milligrams per deciliter. And people with overt diabetes have a fasting blood glucose level of 125 milligrams per deciliter. And it's important to point out that having one measurement at this level doesn't mean anything. It can be a measurement error. You would want to see a pattern of, 2 or more fasting blood glucose tests showing that you have elevated fasting blood glucose. And finally, we have an oral glucose tolerance test, and that's what we see the graph here. So what you do is you get a fasting blood glucose level. Then you consume 75 milligrams of dextrose or glucose, and then you follow your blood glucose level over time to see what happens. A normal person will start, somewhere between 90 and 100 milligrams per deciliter. They'll have a small rise, which can go up to 140-ish, and then you'll see a small decline. And what we really want to see is at 2 hours, we want to see your blood glucose levels come down to or below what your fasting levels were. And with a type 2 diabetic, we just see chronic elevation and it stays elevated. We have here this 200 milligrams per deciliter marker, which is probably, this is one of the measures. Honestly, above 160 is not great and probably indicative of impaired glucose tolerance. So you really want to kind of keep it down below that, the max down below that 140, and you certainly would want it back to normal after 2 hours. A type 2 diabetic does not experience that. Just a little bit to add here on the end as a reminder, this was simply just a portion of a much longer video that tackles both what is type 2 diabetes and how do you manage or reverse it. If you want access to that information, you can either access the full length video or you can access the second part of the video separately, how to reverse type 2 diabetes. We will put the link to those videos down in the description below. Thank you very much for listening in, and we hope you enjoyed this presentation. If you have any questions, comments, or constructive criticisms, please drop them into the comment section below. If you like this video, if you're concerned about developing type 2 diabetes and you want to prevent that, or you currently have pre-diabetes or type 2 diabetes and want to reverse it, this is something we're going to be covering a lot on the channel. It's something that I have personal experience with addressing. It's something that we have a ton of really good data on, so I'll be sharing a lot of new research on this. We'll be sharing tips and tricks on how you can better manage the disease or reverse it altogether. So make sure that you subscribe to the channel. If you like this and feel that other people may benefit from it, please like us and share us on social media so that other people can get access to this information and we can get the word out.